everyone. So today we're talking about anxiety. It is the most common mental health issue in America, and it affects about 40 million Americans. In its simplest form, anxiety is an excessive fear or worry about something that may or may not happen. So the key word there is excessive. We all experience some anxiety in certain situations. I mean, think about it. When you have an interview or a first date or the night before Christmas, we're all going to feel a little bit of anxiety with that, and it's normal and it can actually be helpful. It's when it gets into excessive that it becomes more of a mental health issue. There are several different anxiety diagnoses. There is generalized anxiety disorder, which is a pervasive and persistent anxiety across several different domains of your life. There is social anxiety, which is where somebody worries about their appearance or how they are coming across, or if somebody can tell that they have anxiety in social interactions. There are specific phobias. If somebody has a fear of heights, bugs, tight spaces, there is a really clear trigger for the anxiety. There's panic disorder, which is where somebody experiences panic attacks. And then in a separate video, I'll talk about obsessive compulsive disorder, or OCD. So stay tuned for that. How I treat anxiety, or first let's go over the symptoms. So somebody who has anxiety, they tend to feel terrified, scared. They may have a fear of the worst happening. There may be a fear of dying. They usually tend to experience headaches or stomach aches. So, particularly with kids, if you have a kid who has a lot of headaches or stomach aches and the doctor isn't really able to tell you why, I would have them evaluated for anxiety. People who have anxiety may feel lightheaded or dizzy. They may be wobbly in the legs. You may notice like a shakiness or like a trembling to their hands. People will often report feeling hot or having sweaty palms. Their heart may race. It may beat harder and faster. They usually have racing thoughts, and many people who have anxiety have difficulty sleeping or falling asleep or staying asleep. Most people who have anxiety, they report feeling pretty nervous. With anxiety, there are actually all kinds of nice concrete symptoms that you can look for that will tell you if this person has this. So treatments, how I treat anxiety. I use cognitive behavioral therapy, CBT, looking at our thoughts and our behaviors and seeing if there's anything there that may keep you stuck. That involves looking at some unhelpful thinking patterns. So people who are anxious, they tend to catastrophize, where they think of the worst case scenario, and it's like that's the only option of what may or may not happen. I also use acceptance and commitment therapy, or ACT. What is your vital, meaningful life, and how do you move closer towards that? Anxiety tends to move people away from it. Eye movement desensitization and reprocessing, or EMDR. Sometimes there are specific memories or experiences that we can trace back to, and this is the start of the anxiety, or these are some scenarios where your anxiety was a problem or created some issues. So let's clear those out. Let's clear out the emotional charge of those experiences and see if that anxiety doesn't get better. I always teach self-soothing skills to my anxious clients. When we are anxious, we go into that flight, fight, or freeze part of our brain back here. And in order to get this beautiful prefrontal cortex back online, we need to calm down. We need to soothe our emotions. So we can do this through diaphragmatic breathing, taking those nice deep belly breaths rather than the short, shallow chest breaths. And I use a visualization. I ask people to imagine that your lungs are balloons that you're going to fill up with air. And when you inhale and when you exhale, you're going to squeeze all of that air out. I also like to use another activity called 5, 4, 3, 2, 1. Usually when I suggest this, clients are like, Heather, this is not going to work. Okay, I hear you. Let's suspend your disbelief, hit the pause button on that, try it out, and see what your results actually are. So you can do this right now, actually, with me. Take a look around and tell me 5 things that you can see, 4 things that you can feel on your skin that are touching you, 3 things that you can hear, 2 things that you can smell, and 1 thing that you can taste. What this usually does is it gives our brain a break. It gives our mind a break. It's grounding. We get back into our body through our senses, and it can often sort of refocus people. So that's anxiety in a nutshell. If you have any specific questions or comments, feel free to shoot me a message or leave a comment, and I'll get back to you. Till next time, guys. Bye.